Hello, my name is Christanna, and this is my Unit 14 signature assignment video submission for a functional assessment and intervention design. The case scenario is about a 22-year-old young adult named Jordan who rides as a passenger in family vehicles. Jordan refuses to fasten their seatbelt on every trip and verbally argues with the driver when reminded. When this happens, the driver delays leaving while continuing to attempt to gain Jordan's compliance. The target behavior is seatbelt noncompliance. It is defined as Jordan failing to begin fastening the seatbelt within 7 seconds of a verbal instruction given to him, or verbally arguing against the instruction instead of beginning to fasten the seatbelt. This is considered a behavioral excess because it occurs on every trip, and it's a behavior that needs to decrease. It is also socially significant because consistent seatbelt use is an important safety behavior that can help to reduce the risk of injury while riding inside of a vehicle. To assess the behavior, both an indirect and direct assessment will be used. The indirect assessment will include interviewing Jordan and the driver or drivers to gather information about the history of Jordan's behavior, when it may be more or less likely to happen, and what typically happens before and after the behavior. Call It All explains that indirect assessments can help develop a possible hypothesis about the function of a behavior, but they do not involve direct observation of the behavior happening. Because of this, direct ABC recording will also be conducted across multiple vehicle rides to identify patterns between the instruction to fasten the seatbelt, Jordan's noncompliance, and the driver's response. Call It All explains that although descriptive assessments can help identify patterns between behavior and environmental events, these patterns are correlational and cannot confirm the function of the behavior. Based on the current information, the hypothesized function of Jordan's seatbelt noncompliance is escape or avoidance. The current pattern suggests that noncompliance may temporarily delay the expectation of fastening the seatbelt and the continuing of the trip. Attention will also be considered as a possible maintaining variable because Jordan receives continued interaction from the driver following the target behavior. The behavior intervention plan, or the BIP, will focus on decreasing Jordan's seatbelt noncompliance by teaching a more appropriate way to request for a brief delay of the trip starting while still maintaining the expectation of fastening the seatbelt before the vehicle begins to move. As an antecedent strategy, before each ride, the driver will clearly state the expectation that Jordan must fasten their seatbelt before the vehicle can leave. A first-in statement, kind of like first seatbelt, then we can go, can be used to make the expectation and outcome clearer. Hupp and Reitman found in their study that children were more likely to comply when they had an immediate opportunity to respond to a contingency specifying statement compared to when the opportunity to respond was delayed. Based on this, stating the expectation immediately before the ride gives Jordan an opportunity to respond to the expectation by fastening their seatbelt. Functional communication training, or it is also known as FCT, will be used to appropriately request a brief delay by saying, "Can I have 1 minute before we leave?" or simply saying, "Can I have a minute?" instead of engaging in seatbelt noncompliance or arguing. Geiger et al. Discusses FCT as a functional-based treatment for escape-maintain behavior because it teaches an appropriate communication response that can provide access to the desired escape or break. When Jordan correctly asks for a delay, the driver will provide a 1-minute delay using a timer. Once the timer ends, the instruction to fasten the seatbelt will be presented again. This allows Jordan to access the delay in a more appropriate way while still maintaining the seatbelt expectation. Once Jordan fastens the seatbelt, behavior-specific praise and access to a preferred item or activity, such as choosing music for the ride, will be provided. If noncompliance continues after the 1-minute delay, the driver will restate the expectation in a neutral tone and wait until Jordan engages in the replacement or desired behavior while avoiding arguing or going back and forth. To evaluate the intervention, percentage of opportunities data will be collected during each vehicle ride using a data sheet completed by the driver. A check mark will indicate that the behavior occurred, while an X will indicate that it did not happen. Data will be reviewed after every 10 vehicle rides, with mastery defined as seatbelt compliance on at least 90% of opportunities. If little or no improvement is observed across 2 consecutive 10 ride review periods, the assessment information and intervention will be reviewed to determine whether changes are necessary. Ethical and professional considerations will be addressed throughout the intervention to protect Jordan's dignity, preferences, and the right to be involved in decisions about their treatment. Ethics Standards 107 emphasizes being culturally responsive and considering the diverse needs and backgrounds of clients. compliance. Jordan's individual background values and preferences will be considered throughout the intervention. This is important because an individual's background and experience can be important to consider when providing services to them. Ethical Standard 211 requires behavior analysis to obtain and document informed consent when required before implement behavior change interventions. Therefore, informed consent will be obtained from Jordan before the intervention begins, since they are an adult. If Jordan is unable to provide informed consent will be obtained from whoever is legally authorized to represent them. Ethics Standard 215 focuses on minimizing potential risk and using less intrusive procedures before considering more restrictive or punishment-based procedures. This intervention follows this standard by focusing on less restrictive reinforcement-based strategies such as functional communication training and positive reinforcement. Lastly, there is the Ethical Standard 216, which requires behavior analysis to explain the intervention procedures and conditions needed for implementation before the intervention begins. The drivers involved in this intervention will be provided with clear instructions and training on how to respond to seatbelt noncompliance, provide the 1-minute delay, deliver reinforcement, and collect data consistently. Any changes to the plan will be explained as well.